Good morning, residents. Today we'll be discussing something which really troubles many of you. Preparing and presenting a seminar. Whenever you join the department, I think most of you within the first 6 months and certainly within the first year would have had one or two occasions to present a seminar. And we're talking about the seminars that are presented by postgraduate trainees. And it is not just in our discipline, it be it any discipline when they join the department and when they have to make it. Generally, it will be a departmental presentation. Sometimes it is a unit presentation, and some of you would be thrown at the deep end. In the first year itself, you have to make a presentation in front of the entire hospital. And that could be very unnerving. So what I will do is share what I have learned from my own mistakes and what I have seen over these decades, how not to prepare and how not to present an academic seminar, because once it goes wrong, it affects your confidence, and sometimes the impression people form about you is based on just one or two seminars. Some people have done so well, we still remember. And it is amazing, sometimes you surprise some of the trainees in the first seminar itself, they were absolutely bang on. And some of them, while they are finishing their training, they're still struggling to give a good seminar. And there could be various reasons. Doesn't mean they're not good students, they're not good trainees, but something they haven't missed, or just, on that day of seminar, they have, they become nervous. There is performance anxiety, and that's why they do. So what I will, and very important, the last part is how to get feedback for improvement. So this I'm showing, I just managed to, in my papers, found this in March 1990, when I was a second year, a year before I appeared for my MD exam. This is a seminar that I gave, and the title was Role of Radiotherapy in Head and Neck Cancers in General. I mean, you might wonder what this means in general, but that is what the title which was given to me. And students can't choose what is the title given to them. And I will come to this about that topic and the title. And so I had, those days, there was no PowerPoint. There was a Harvard graphics, which was just come the department. There was only one PC XT, or before the, the Pentium came, there was the earlier version of the PC, the first one in our department, the old one. There was something known as Harvard graphics, HG, on that. And then, of course, the PowerPoint came and it revolutionized everything. And now then the internet, this was before pre-internet, pre-PowerPoint era, and there was just one computer in the department. Obviously, no, we only used to have projectors for the slides and overhead projectors for the transparencies. So before I talk about it, let us look at the literature. I mean, this is not something we should reinvent the wheel, not reinvent the wheel, rather. I would say we should not reinvent the wheel. A lot of research has gone into it. So I'll just talk about the seminars and teaching methods, and residents, as trainees, postgraduate trainees, you have done your MBBS, you're already medical graduates. So in this study, which was looked at effectiveness of modified seminar as a teaching learning method in pharmacology, this looked at the medical college in Kerala. And what they say, actually it is correct to some extent if you really introspect. Students consistently rate poorly the traditional student-led seminars. Many people get bored of. Your close friends, of course, will, or those who have helped you and prepare the seminar, they'll be with you. Others, and these days you have very good distraction of your phone. If no one is watching, you just catch up with your mails or your messages, etc. So they had a modified student learning seminar, which included role plays, quiz, test, group discussion, and a patient-oriented problem-solving exercise. And then they compared with traditional seminar. It was an interventional study. And what it was found that interaction was the most important component of seminar. And if you think of it, in many seminars, there's hardly any interaction. Someone will come, has 60 or 70 slides. They will just rattle off all the slides. One or two faculty members will ask some question, and there's no interaction. So that's why in your seminars, when some of the faculty will tell, will request you to please ask question and nothing is happening, because it is to improve overall effectiveness of that 1 hour of 30 or 40 or 50 people. And most of them opine that the teacher should summarize at the end of the student learning seminar, which does not always happen because, again, you run out of time. Then modified seminars created more interest, enthusiasm, and inspiration to learn and also increase peer recognition and group dynamics. So peer coordination, recognition, and group dynamics is very important. And students opine that communication skills and the interaction between the teacher and students were improved with modified seminars. So there's been a systematic review of residents as teacher program. So they have been, this has already been acknowledged that residents in all disciplines serve as clinical teachers for medical students. So some colleges may not have undergraduate students, but wherever there are undergraduate students, you will be involved in teaching them. And there is a lot of information that residents wish to teach and they respond positively to formal teacher training. So this is the fact. And effective residents as teacher programs, so they were not like the name RAT, have improved, and this has happened mostly in the West. They have improved residents' teaching skills, but the current evidence wasn't clear whether the specific features of our program, residents as teachers program, that will make it more effective. So this systematic review was done to see the effectiveness of residents as teaching program on the residents' teaching abilities and identify what are the features that ensure that this residents as teaching program is successful. And you might say that, well, we don't have undergraduate students, so where are we as teachers? But someone, a second year resident, when they are giving a seminar, someone who has just joined their department, they look up to you with so much of expectation. They think that this person can teach me. And a third year or a senior resident or a third year resident, when they are giving a seminar, you are basically teaching also, so you are teachers, and of course it is more of a focused teaching that you are doing. And they looked at the literature, and what was found that in some of the studies they had used a pre and post intervention. So the subjective outcome that they measured included residents' self-evaluation of teaching skills or evaluation by the medical students, peers, and faculty members. And they also had objective outcome measures. Some of the studies had objective outcome measures before and after, which were written test, evaluation of teaching performance by independent raters, and utilization of objective structured teaching examinations. So overall, the residents were satisfied with the resident as teachers program, and the participants reported positive change in attitude towards teaching. So if they were participating in a teaching program, residents as teachers program, they reported that yes, it brought about positive changes, and their knowledge of educational principles improved. So sometimes there are educational principles, medical education principles, which have evolved over last 77 or 8 decades. So they are useful. Sometimes we are not taught that in practicing departments. The study method, of course, this study could have significant bias. And finally, it was, it came out that more rigorous study designs and the use of objective outcomes are needed to ascertain the true effectiveness of residents as teachers, program. So this is the need. And in India, very little has been done. I will just show 1 or 2 examples what has been done. And there should be programs to determine the impact of residents as teachers on the learning and achievement of medical students. So in oncology, actually, very little has been done. I did a literature search. There are a few sporadic small studies which have been done, but all the seminars, just imagine the hundreds and thousands of hours every year residents in one department would have been spending in preparing, presenting, and listening to seminars. So how much is the outcome of this? So this paper from University of Toronto, so they had students and teachers of a program. This was a 4-week students as teacher program that was developed for the final year medical students, and it was assessed for its impact on students' development as educators, their experience as learners and educators, and their future, how they would plan to be involved in medical education. So in this, students participated in small interactive group seminars and teaching opportunities, both in clinical and non-clinical environment. And I'm bringing in seminars here because if you look at many places, this interactive and group discussion comes. And just you remember what happens in the seminars in your department and you think what does not happen. And that's why the whole opportunity is wasted, how much time we spend. And after this students as teacher program, Students self-reported greater knowledge and confidence in teaching methods, provision of feedback, medical education scholarship, and interest in further medical education training. And they highlighted three key themes. That is very important. So identify formation as educators and the importance of mentorship in medical education aligned with our program theory, while an unexpected outcome included a shifting perception on teaching and feedback from a learner to an educator lens. So this last line is very important. Shifting perception on teaching and feedback from a learner to an educator lens. So you think that as residents you are only learners, but then you are also educators. You educate your juniors, you educate other members in the staff, and later on you actually become a teacher or a faculty. Then you have more formal teaching responsibility. And very important, the positive, what they opine this group of students, that the factors which contributed to programs outcome include the cohort size. If it is a very large class or very few people, it will not help. The course and seminar structure and the active group participation. So both are important, the course structure, the seminar structure, and everywhere you will find it is the active group participation, and that is what we see often lacking. Now, in this paper from Heidelberg, just few more studies that I'm presenting, then I'll come to our more practical aspects, is determinants of participation in seminars as part of postgraduate training program. So this, like for general practice residents, this was not compulsory. Some people participated, others did not participate. So there were 353 trainees, and then they interviewed 30 of them, detailed semi-structured interviews. Some were attending regularly, some were rarely attending. And what was found that the trainees felt motivated by practice-oriented, varying and learner-oriented subjects. That is very important, what subjects to retain the interest. And they highlighted the participants, the professional and personal interactions during these seminars and its networking effect. So networking is also important. And they favored lectures during working days. So many times we keep on a Sunday afternoon. I think that's it's cruel to keep a seminar on a Sunday afternoon. Residents also have a life. Then the topics that were structuring daily training and supporting everyday practice. So more practical aspects were more appreciated. Then the seminars, moderators, treasures trove of experience. This is the language they've used, the treasure trove of experience, and the teaching competence were regarded as essential. So anyone who is moderating the seminar, it could be a senior resident, it could be a young faculty, it could be a very experienced faculty, but their experience, and not just the experience as clinician, but also their teaching competencies were regarded as essential. If you don't have that, then you can't have a successful seminar. And importantly, they also identified there are many people who are not attending seminars, and that happens sometimes in your online classes, that employers do not regularly grant time to attend training programs. So sometimes you are in a unit which is very busy, or it may not be so busy, but they do not allow you to go here and there, and it is not considered essential time. Then travel distances, repeat topics. So sometimes they're so repetitive, and actually the title has been different, but the student has done a lot of repetition. So a lot of things that were covered in the previous seminar, you are again talking about that. Then imbalance between gain of knowledge and social interactions, and of course the burden that they have of other things. So what we call of burnout, etc. These are real things. Another study from Germany, this is a look at medical students to manage emergencies. They look at the traditional seminars versus so they were randomized to receive standardized patient simulating 3 emergencies. So like chest pain, stroke, and acute dyspnea, or traditional small group seminars, so up to 25 batches, which is a favored method in the West in the teaching. So what they found that the knowledge which was assessed by MCQ and the practical performance assessed by objective structured clinical examination using 3 different emergency scenarios as described. So standardized teaching using the 3 standardized patients result in significant, although it was small, improvement in objective structured clinical examination scores, which is the practical aspects. But the written examination scores were no different, whether you had a traditional small group seminars or you had a training on standardized patient simulating 3 emergency settings. So you might find that when you your exam, exit exam, you have a theory exam and then you have practical exam. So in the theory exam, someone may not have been very good in the clinics, may not have really understood the subject well, but they might get away in the theory exams and they might do reasonably well. But it is when they come in the viva voce, in the practical exam, when they have to discuss about a particular patient or about a particular x-ray or a scan, that is when then their shortcomings in their training or in their concept, they are exposed. So I think in the seminars, if you bring in more of clinical situations or an example, that is how it will improve your training. Then students' perception about what affects seminars, learning in a seminar. So in this, they had 24 students. So what was important, I think each and everything you would identify with. So they said that seminar learning affected by the course schedule, coherence and alignment of different educational methods, amount and type of seminar questions, amount and clarity of the preparation material, didactic approach and facilitating methods used by teachers, the group composition, size and atmosphere, and again, the most important, the amount of active student participation and interaction and assessment. So all these things are very important. I mean, we know it in theory, but when we are preparing a seminar or when we are delivering a seminar, when we are just participating in a seminar, that how often we do it, that is the question. Then the same group also looked at the teachers, a qualitative study of the teachers' perception. So again, 24 students. So the teachers identified 7 key aspects. So one was the seminar teacher's role in developing seminars and ownership. That is very important. Then the students' preparation, amount and quality of preparation materials, and the group functioning, whether sometimes what happens, I will specify that in some of the low and middle income and Asian countries, so hierarchical that even if no one is threatening you, the students feel intimidated and they feel, and sometimes actually it is a threatening learning climate, no doubt about it. I've witnessed that. It is a non-threatening learning climate is better. Continuity of group composition. So when the same group forms this thing, it helps. Then seminar goals and context, suitability of subjects, the number and quality of seminar questions. Then course coherence and schedule. So, and the last is facility. So all of these experienced teachers have identified, and you would also see that if some seminars go perfect because many of the things that were identified by the students and by the teachers, those things are taken care of. And that happened to be a day when there was no technical glitch and everything went off fine, everyone came in time, then it will be a perfect seminar you will remember for some time. So Joseph Joubert, who was a French essayist and philosopher, what he wrote is so poignant. Teaching is learning twice over. So when you are giving a seminar, you are teaching, and actually that is when you are really learning the most, and that is very important. And as medical resident, so which is medical resident, that means you have done your medical graduation, MBBS, and then you are teaching. You may think this is just an assignment given to you, but you are actually teaching. And what Benjamin Franklin said, it is so important, and I'll tell about the importance of this as in the seminar. Tell me and I forget. That means you just tell. Some seminars are just full of information, just blah, 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 blah. Slides are crammed, they just tell you. Teach me and I may remember. That means you try to explain it to what is written, why it means. Then you teach me and I may remember. Involve me and I learn. So in a seminar, the involvement could be discussion, the question answer session, or you bring out some clinical scenarios with which people will start thinking. And that is where, maximum learning happens. And you yourself will get a feedback that in the seminar that I gave today, I could actually teach certain points and involve the audience, and that they would remember. And certainly you would find that 2 years, 3 years, 5 years down the line, someone will come and tell you, well, you gave that seminar, it was very nice. They may not be able to explain to you why that seminar was nice, and you may not think, but maybe that was a seminar when you involve the audience and they learned something. There's always something to learn in a seminar, even as a faculty, experienced faculty, when we go to a seminar, even by a first-year resident, if they have prepared well and if they're teaching well, you would learn. So I was looking at what happens in India. There was very little. So these residents as teachers program is non-existent in India. So this in Indian Journal of Pediatrics, there's one study from Chandigarh. So in this, what they've found, basically they discussed this issue that training module for residents in medical education technologies, TRIM. So this, in this paper, they have proposed such a program, and then they emphasize that the need for inducting residents in department formal teaching activities. So we always lament that our senior residents, we don't want to use them as pair of hands, but finally they end up being a pair of hands. So amount of teaching as senior residents they should have done, they do not do. Maybe the fault is ours. We have not really formally trained them as teachers. That is why, you know, it doesn't come intuitively to everyone. Some people are sort of born teachers. I mean, they would just love teachers, and people would remember them for 10, 15, 20 years, that person used to take so much of interest in teaching, but it does not come naturally to everyone. So they have not been trained, and the benefits are for the student. That means in the department, postgraduate department, the new trainees, for the residents and senior residents, and also for the institutes. And finally, it all reflects in the better patient care. So this is the so to prepare and present a seminar. So first is know your list of topics in seminar series and what is your topic, the audience composition, who all are in the faculty are likely to come in that seminar or in that seminar series, time that will be available to you to prepare and to deliver the seminar, your own limitation and current knowledge, what is there in the literature, where to find the textbooks, review articles, research articles, what is your unit, hospital, local, national practice and data, medium of presentation, the norms, environment during presentation, and infrastructure. So I will come to each one of this. So first is, and I think that is a very key point that I'm showing, is topics and titles in the seminar series and your title. So it could be a seminar series. Sometimes series has a structure and the way how the seminars have been listed in one after another. Sometimes it is just just at random. So that is important. And what is your title? And I'm saying is you're not just the whole thing, the title. So topic versus title. So I'll give an example. So the topic is just say carcinoma endometrium, severe endometrium, or bone mets, versus title could be the molecular subtypes of endometrial carcinoma, or management of bone metastasis in prostate cancer, or recent advances in oligometastatic bone metastasis. So you have to understand what is have you got a broad topic or a theme on which you have to give a seminar, or it is a specific titles, and whatever the title it is given in that, you have to know that. Sometimes you might wonder why the title is written like this. Maybe it is an error, but more often than not, if a senior person is involved in mentioning the seminar, developing the seminar series and writing the title, there's a reason why they've chosen that particular title. Then you should know whether it is the first seminar or no one knows about previous topics or titles. Some departments are not really structured. It is happening once in 2 months or 3 months. Then what are the titles of previous and succeeding topics list and seminar details? Whether if you know them, it is very important, because as I mentioned, one of the reasons which puts off people is repetitiveness. So if similar topic or related topic was there, if you see that there is overlap. Someone would mute, I think. Okay. One second. And sometimes there is a confusion about the title. I think before you get onto this I've seen sometimes the residents would send their draft presentation 2 days before, or sometimes some of them would be so good they will send a week before. And then you realize they have just not understood what was the title given to them. And I don't blame them. So they're confused about it, but then they had to start preparation. So they have prepared, and you can't hardly make any change in the last 2 days. So if your title is ambiguous, it is not clear, you please clarify and you ask what is expected on that title. Then the audience composition. during the seminar, who will be the moderator and the faculty? Is it the same person or someone new is going to come? The faculty and the level of training of the trainees they would have, whether you would have first year residents or many senior residents, or the mix of people. Then it is just one discipline, your particular discipline, or members from other departments also will be there. Whether the researchers will be there, whether lay persons will be there, and whether your seminar would also be seen later on, because it will be in public domain or in YouTube or any other channel. So if suppose you should be prepared for the type of questions depending upon the audience composition. So as I mentioned, it is very important. It's an interactive seminar. A seminar in which no question is asked is actually a bad seminar. So you either people did not understand it, or they were not interested or bothered, or they thought that you will not be able to answer that question. But the most important reason why there's no question, because you took so much of time that there was no time left for question and answer session. So keeping all this in mind, you have to prepare your seminar. So actually, when you are asked to give a talk in your department, you know what the type of people are there. If the first year, sometimes to judge how effective you were in a seminar, I do that. If a first year student has attended a seminar, when they come back and I ask them, okay, just very simple key things. If they were there for 1 hour in that seminar, and if they have not understood even the most basic key elements, what they should have understood after spending 1 hour, that means there was a problem in the way you either prepared the seminar or the way you presented your seminar. Otherwise, it is not possible that someone after an hour, spending an hour in the seminar, could not have understood that. Then the faculty is very important, because as it was found in some studies, the faculty is a key role. So the faculty who takes ownership of the series of seminar, then the person who's taking care of your topic, because in many departments there's site specialization and subspecialization, and that faculty may have major practice in that area. Some people may not the practice may not be very large, but they have major research or research interest in that area. So you will get different feedback from different faculty. And very importantly, as a faculty member, it could be a young faculty member or lecturer or assistant professor who's available before and after the seminar for insightful suggestions and critique. And sometimes we are, as residents, we are a little scared of going and meeting the faculty, because they would ask questions. They would know that you do not know this. Does not matter. You go and meet them, and you will always find, if there are 5 faculty members, there are 1 or 2 people who would be non-judgmental and will give you good feedback and insight on how to learn. And they will give you a general idea as to how to go about the subject. Then time to prepare and present a seminar. How much of total training time can be devoted to preparing for a seminar? I have seen people spend 2-3 months preparing a seminar. Something very important was there on the weekend, or they did not attend because they had to present a Monday seminar. I know so many cases, because I used to sometimes have social gatherings at my home, and some people would not come because they had a seminar on Monday. So they were so nervous. And not just that weekend, they were preparing for months together. You can't spend your 3 or 4 or 5 years of training, spend 6 months preparing for the seminars, 4 or 5 seminars you have. Then what is the seminar time? The scheduled seminar time, including the settling down time. Most in our country and in many countries, most seminars will not start at that time. If it is 8:30, it may not start at 8:30 sharp. It might start at 8:35, 8:37. Then the QA time, as again, I just cannot say that again and again, but there has to be a time left for question and answers. Then interruptions time. Interruptions, some people would just really irritate you, or some people will just go on and be repetitive and ask some point. So you have to figure out, keep some time for the interruptions. And these days, it is the technology which is a big interruption, unexpected. This thing sometimes it could happen. In earlier days, our projector used to sometimes get stuck, or slide used to get stuck. These days, internet issues and many other issues, they could happen. Sometimes you're just not able to start. So ultimately, it's time. I think thinking about time for each and every aspect, and if you prepare your presentation, keeping that in time, that you start in time, you finish in time, and you have enough time for question and answer and little bit of margin for some interruptions. So that depends upon how many slides you have, how crammed or busy your slides are, and whether you know that subject well so that you can explain it in a flow. Then own limitations and the current knowledge, that is very important. So know yourself and seek appropriate help. So why I'm saying that, I've seen there have been times after some time you realize this person, question does not understand anything. Is like someone is presenting a seminar on intracavitary brachytherapy in gynecological cancers. Then you realize that that person has never had a gynae posting. So there are many departments where they are site specialized training. So they haven't had in the first year of their residency, they haven't had a gynae posting, and for some reason they had it was just bad luck. Their bad luck that they had a seminar topic on intracavity. So if that happens, you go to your faculty and you say, I will be presenting this seminar, but I haven't had gynae posting. So you, more often than not, you will be given a different topic, or else when the faculty in charge is there, they know that this person hasn't had this thing. You could still go and ask people who have had, your senior residents and others, and know little bit, and maybe just go on few afternoons when you are a little less busy in that part. Then preparing for seminar. So one is to begin with, the general and the topic guidance is most important. And if you don't do that, which is often lacking, you think you will just pick up a textbook and you will start, doing that, it will not help. That is one of the biggest reasons. So before you start, you take a general and topic guidance from someone who may be just 1 or 2 or 3 or 4 years senior to you. That is very important. And if it is a general, I just give an example of endometrial cancer. You can look at the whole, if you look at the entire, section on endometrial cancer in DeVita or any other book, it is so much. Then what is expected in your seminar, in your department, in the seminar series that happens in your department, so that you would get. And if it is a specific focus topic, then that is where the catch, you sometimes do not get it right. If you are not that experienced, you haven't had that much of clinical experience in that particular malignancy or technique. So that is where you need guidance. And I think you spend some time, don't just talk to one person, talk to different people, and you will just get an idea. You have some framework in your mind. Then textbooks. Remember, textbooks, what is there in the textbook is the most important aspect. So if there's a section in that textbook, important text, that in that part is important. But also remember, a textbook published in 2021 would have been, the chapters would have been written by the faculty in 2018 or 19, because it takes time, few years, at least 2 years for a textbook, authors to submit their articles for proofreading, for editing, and finally coming out in print. So, and when they wrote the chapter in 2018 or 17, they would have, looked at papers which were published in 15 or 16 or 17. So that will already be outdated by 4 or 5 years. So the information. So if it is a general topic, yes, a textbook would help. But if you have the title of recent advances in the, let us say, management of a particular disease, and if you're just referring to textbooks, it will not help. Then the review articles. Review articles is very important. That is it just a general review? Is it a systematic review? Or is it a meta-analysis? So that is very important. And if you can lay your hands onto that, and you also see that the title of the review or the keyword that were used for the review are matching with your title or your topic. And don't just, some people will just find one review article so handy and they've just taken everything from them. And actually that review article was only partly relevant to your topic. That is not acceptable. So you please be careful, and just you apply your mind to it, you will know it. Then research articles. So you have to quote few research articles. So you see the key papers, the seminal papers on that, they have to be quoted. Then very important, you should also have, and that is something which you will judge by the good students, you take effort to get data from your unit, from your hospital, and the local and national, both practice, how that thing is practiced in your hospital or in your country, and also data if you have. Many times there will be audit data or you speak to residents. Then the content, structure, and medium of presentation. So PowerPoint, everyone uses PowerPoint. What else? So, till few years ago, in our country, in India, there were few departments which had banned PowerPoint by trainees seminars. And the reason was, people, everyone knows there's a slide share and there are other medium, and people will just take copy slides from there and modify it a little bit, or sometimes not modify, give acknowledgement to that thing and just present. So why was it shunned? Because the purpose of the seminar, student-led seminar, was that you also learn, and in the process of preparing for seminar, and if you have learned, understood, then you'll be able to teach more effectively. And that is when the others present in the seminar will also learn. So they were, and plus, if you take just borrow slides, you will have so many slides. So they were asked to either write on whiteboards or overhead projectors on a transparency sheet. You will write with these pens, and they'll be presented. Of course, now the OHP overhead projectors are itself disappeared. So that is important. Then the correct file version. Okay, many of you would have so many files and you have not saved it properly, or some other version is there and you may not have put it on your drive and you are using an incorrect version. I've seen that happen many times. Okay. Then some people try to make it very fancy, put in some videos, and the media player would not always play some videos, and then you would have lost 5-7 minutes and it will hang. Then you will restart, and your entire flow, what you wanted to make it more, more effective, actually it goes for a flop. So you should use videos if they're absolutely necessary. Otherwise, just diagram. Then how you format content and structure. And this is very important. Some people would use colors which are so jarring. Okay. Of course, we like, everyone should have individuality. We like you use a different style, your flavor, your touch, if it is evident, we appreciate it. But don't use jarring colors, and you can actually make out a presentation that has been made by a newcomer. Some people would spend so much of time in formatting their slides, so much time that they have hardly any time left for actual reading and thinking and all that. So the slide may look beautiful, but you know little about what is written in that slide. Then it may be so cramped. I think anyone who apologizes that, oh, I'm sorry, this slide is very busy, you can't read it, then what's the point of putting that on a slide if people can't read it? If you wanted to see, you can just mention, or you can just put a blurred image. This is an image, so that is important. And then how you have structured. So some people would have actually everything in the presentation, but they haven't come up in the right time, and they have later on, they have in the slide, but when they should be coming, they have not presented that. That is very important. So when you are presenting your seminar, know what are the norms of the seminar. So in each department, each hospital, each unit, there are different norms. So, I mean, you might argue why this is expected, but whatever it is, you follow that. Then what is the environment during presentation? It is threatening or non-threatening environment, very interruptive. Sometimes, it is so interruptive. So if suppose one person or one faculty is asking you again and again, and if it is there, instead of explaining, you can say, sir, I have this in the subsequent slides, I will come to that. Okay, that is one thing. Then infrastructure for presentation. These days, one of the issue which comes up is internet. So many times you have your good on the phone, you can connect with your phone hotspot or something else. Then it is working. So person who's presenting the seminar should come 5 minutes in advance and see that things are all ready, the slides are loaded, and not come at the time when everyone else has come. Because in the beginning itself, if you become a little nervous or little, you have just come, running up the stairs, you will not be able to settle down. So give time yourself to settle down, load your slides and be ready. And you see that all the slides, sometimes you would find that the format has changed your slides. Some of the things are being, cut, not being shown. So you again, because you have to load your slides on a different system. So this is in general, all the things that I have covered. And one thing I would say, my actually message to all the trainees is, invariably there's so many slides and you should actually have maybe one slide, 1 minute. and a slide should not be crammed 10 lines, 12 lines. If you have more than that, then it is, people find it difficult to read. The font size, the background, this is very important. So you should have read and understood everything. Instead of putting 60 slides, if you initially, when you make a lot of slides, then you combine some of those slides. Some of the slides you hide it, and or you keep as backup slide. You keep it at the end of your presentation. So if someone asks that and goes into that, what about that? You have not shown that. You can say, I have a slide I have not included in the presentation, and you can bring it up during the question answer session. And if it is going in a flow, then there are less chances that you will be interrupted. And people also look at the enthusiasm with which you are speaking, and that also helps you to sail through. So I will just very quickly, just in few minutes, show that. So this is in March 1991, a second year resident. This is a very unusual topic I was given: role of radiotherapy in head and neck cancers in general. So that was before PowerPoint. So we had an X-ray box, the big X-ray box. We used to cut out of it, and we used to call bioscope. So we used to put these A3 size papers, right, with the marking pens on that, and one by one we used to pull them out. So this was a type topic in general. So when I had to write, so maybe my faculty members wanted me to have a broad understanding of radiotherapy in head and neck cancer. That's why the topic was given to me, which I understood much later. So my first slide was head and neck cancers are a major oncological problem, especially in our Indian context, where it accounts for 29% of all malignancies, which was TMH. The sites mainly involved are oral cavity, oropharynx, hypopharynx, larynx, nasopharynx, and squamous carcinoma, the most common histological type. And most of these cancers are closely related to habits and carcinogens. So I have talked about the risk factors, about the incidence, and about it as a health problem. So this is my general stating. Then I've given the TMH data of 1987. This was in 1990 I was presenting. Percentage of all cancers. So they accounted for 30% of all cancers. And also I have provided. And then this slide. So actually, when you look back at your slide, this is now 32 years ago. So I've written teamwork for optimal management. So oncologists, both radiation, surgical, and medical. Plastic surgeon, I think I've inserted it later, I thought as an afterthought. A dental surgeon, nutritionist, occupational therapy, speech therapy. So these are very important. This is true also today. And joint evaluation and disease making. We never had a head and neck joint clinic in 1990. We had in Tata Hospital, we only had gynae and lymphoma joint clinic. And proper referral and treatment facilities and follow-up records and feedback for better management. So this is something which was important. And then in those days, radiation and surgery were the only curative management, and chemo was still considered investigational, and its role was in a state of flux. Then radiotherapy in head and neck as single modality, combined modality, just broad outline, both a single modality, external brachy or with brachy, and then different settings. It could be used as curative, palliative, salvage, or investigational. Investigational those days were hyperfractionation, chart, continuous hyperfractionated accelerated radiotherapy, radiosensitizers, protectors, neutrons, and heavy ions. So these were, so everything is all covered in that. And of course, we had 30 minutes to make a presentation those days. So this was just 14 slides. Then role of basis for the preeminent role of radiotherapy as a single modality in head and neck cancer. So when I was making those slides, I remember why I was given this topic, role of radiotherapy in head and neck cancer in general. That means my faculty wanted me to think and then write, and that was so important. So what I've mentioned is majority are squamous carcinoma, natural history, and spread patterns predict usually a loco-regional disease, functional anatomic integrity, etc., etc. All these things, and then compared with surgery. Then rationale for combining radiotherapy and surgery. Then a chart, then why you have more of central failures with radiotherapy and more of peripheral failures with surgery. And then how by combining both the modalities, you improve loco-regional control with acceptable functional and anatomic deficit. So this is the flow. Then pre-op radiotherapy, advantage and disadvantage of pre-op radiotherapy. What is the dose? Those days the dose was 50 gray before it became 60 gray. Then post-operative radiotherapy, what are the advantages and disadvantages? Then some key studies, like in this was in 1990. So in just 2-3 years ago, there was a study published in Red Journal by Moore, which about the results, the prognostic factors for loco-regional controls. So with the numbers and the p-values. and about the neck nodes, what happens in clinically. So this is the last slide which I had, and actually when I read this, I was very pleased. So when I don't know why I made this slide. Responsibilities of radiotherapist in head and neck cancers, and I've written priorities. So first is maintain and improve the standards of the clinical practice of oncology as a leading member of the team. So I was a second year resident. I thought we should be very, this thing. And those days, this was no joint clinic in head and neck. Then clinical research to improve therapeutic ratio, which is time dose fractionation, radiation sensitizers and protectors. That was not happening. So then early diagnosis and intervention in pre-malignant and malignant lesions, active participants, and formulate preventive programs, as majority of these cancers are closely related to habits and carcinogens, and also basic research. So, so each of the resident, like I feel this was my opportunity to showcase that I'm thinking, that I have a vision, I have a plan. So maybe I'm just thinking, maybe this was this one slide when my head of department would have thought, well, this boy can do well, or he could be a faculty. So you never know. Some of you have been chosen, or you come into our this thing because of a seminar that you presented. So in addition to whatever is there in the textbooks, you have really crystallized it, or you have given it your own this thing. So I will just stop share. Okay. Sorry, my video, I'm unable to switch on my video. So I will have Dr. Sajal Kakkar is there. He wanted to share an anecdote. There were three other people who wanted to share their anecdotes in this. Anyone wants to? No. Okay. So some of the anecdotes that were shared by others is that they were so scared of making a PowerPoint presentation, and they did not know they had to go and get it done professionally and paid hundreds of rupees. And I've also, even before PowerPoint, we used to make these slides, and the first one I made for a presentation, this thing, I actually had to shell out few hundred rupees, which was a huge sum to that. Okay, so if anyone has any comments or question, any of the faculty members, Tanveer, or any junior, first year, second year, or a resident, anyone wants to say anything? It is a huge opportunity. I think if at least one person should benefit from giving a seminar, the person who's presenting, and sometimes you feel even that person has not benefited. It has been just a complete, I should not say waste of time, but that person has spent so much of time without really benefiting out of it. So that is first and foremost. If before your exam, you are not looking at your own seminar notes or PowerPoint presentation, that means it was a bad one. Okay. When you are in a hurry, when you have only half an hour to look at, say, a particular cancer, today I'm using example of endometrial cancer. If you don't bother to look at your own seminar, that means that seminar was not really prepared well, or whatever you presented in that seminar, you do not remember. So you should at least learn, the person who's presenting. Then the people who are there should also learn. Everyone from the first year trainee to your faculty, everyone should learn. And people are grateful. If you have taught them something, they may not realize it, but subconsciously they would have understood that something they have learned by spending that 1 hour. Everyone's 1 hour is so precious. Don't waste others' time. So don't waste your time. That is criminal. And if you waste others' time, that is also bad. So that is something which you should learn. And once you start delivering it right, then you get confidence. And then once you get confidence, then you do even better. And ultimately, you in later on in life, whether you're an academic program or not, many of you would have to make presentation. You will learn your presentation skills. You will learn how to do it in short periods. And many times the students, when they are in the best paper session, all they're given, poor people are given only 8 minutes or 12 minutes. But I'm amazed how in those 8 or 12 minutes, they will give the background. They will also talk about the aims, the methods, the results, and discussion. I think the reason they are able to do that because they know that topic very well. It is either their thesis topic or something which they are doing well. and they really understood it. Whereas in the just 8 or 10 minutes, they're able to get it right. Whereas in their seminar, people look at it as a mundane responsibility. Why do I have to do that? They're not really into it. In your entire training, you may have 3, 5, 7, 8, 10 seminars. At least those things you should know well, and you should have left your mark that others would benefit out of it. Okay, I think we will end the seminar here. Any comments or questions? I'll just see.
2 minutes, sir. Hello, sir.
Chat. Oh, this is just general. Thank you. No.
Sir, Tapas here.
Yeah. Yes, please.
Sir, good morning, sir.
Yeah.
Sir, it was a really nice and excellent presentation for the beginners, the MD and level students. So, sir, actually, sir, we have started MD radiation oncology in Sangrur, sir, from this year,
okay,
2021. So, all our 4 MDs, they are on your class, sir, today online.
Oh, how nice.
Yeah. So I would request them to self-introduce themselves.
And each one of us remember our first seminar. I can bet there will not be a single doctor who would have forgotten his or her first seminar.
Yes, sir. Absolutely. I also still remember my MD's first seminars.
Yeah, it is. And how much of effort. I know my first seminar was on carcinoma esophagus. I prepared for 2 months. That was a general carcinoma esophagus.
Yes,
so,
sir.
So much I read about it. I still remember. Unfortunately, I have missed those notes. This one I found of, second year head neck. So, it will be a wonderful opportunity to learn and to teach and to become a teacher. And yes, whether you like it or not, you will have to be a teacher, because we are not, practicing in isolation as a general practitioner. So that's very important. So, and once you do that, you will learn it. It is such a joy to teach others and to learn.
Yes, sir. So recently we have taken their seminars, 3-4 seminars they have given, and we are exactly in the same line like you told how to prepare a seminar. We are also guiding them how to revise and improve it further in their subsequent ones. So I will try to attend all the TMH seminars also online with Sangrur, so that they can have a good platform, academic platform to learn the things. And same time, we will also present from our side also.
Oh, that will be wonderful.
Yes, sir.
So just one last key point is, what is written in your slides. And yesterday, Dr. Sayan Das, he sent me reply to my tweet with all 8 or 10 points. What should be there? Your slide should not be crammed. Know your topic, understand it, know what is written on your slide. Don't have too many slides. These are really key things. And if you just pay attention to simple things, you will get it right. And one day people will actually look forward to your seminar.
Yeah. So can we take 5 minutes? They can introduce themselves. If it's
sure.
Yeah. So really please start from yourself. Soptik, Tanvir, Dheeraj, anyone there?
No. They've given it a miss today. Maybe they are there.
No, they were there, sir. Exactly. Actually, all of them were there. Probably it's 9 o'clock and we have sort of manpower. So they have gone to OPD or something.
Might have.
Yes, sir. So anyway, next place I will introduce them.
Tanvir, you used to teach so much, and I still believe you teach a lot to the residents. People tell about Tanvir as a senior resident or chief resident used to catch us. So you tell us about your teaching experience and your first seminar.
Sir, I remember my first seminar. My first seminar was on spinal cord tumor, and means how much. I mean, one night before, it was literally a sleepless night. And but the best part was that we were very particular in showing the seminars to the teachers before. So when I had shown the seminar to Jalali sir, and when he had okayed it, during the seminar itself, I mean, when he appreciated it,
Yes.
it's a big deal. But still, I remember my first seminar for the junior resident was for Nikhil, and the topic was cancer trend. And Nikhil had prepared for 3 months, and he made me to sit for 3 months every day in the evening that you have to sit with me so that I can prepare well, you know. So it was really wonderful thing. But sir, as of now, what I see is that the majority of the issues is not with the residents; it's more from the faculty side, because what baffles me at times, we all of us we do that. Most of us we do. Even when we go to our seminars, most of the time we keep on fiddling with our mobiles. Either is not that every important thing to see, but many times we are even checking the WhatsApp messages, typing. So that also, when we have
That
asked
is true.
residents, they say that they get distracted by this because they feel that the
Tanvir, your
faculties are
voice
not
is
liking it.
fluctuating. Keep the mic closer to your mouth.
Okay, okay, sir. So residents, they say that
Yeah.
when the faculties keep on fiddling with their mobiles, checking messages,
Yeah.
writing
Yeah.
something, so
It is
they
very
get
irritating and
distracted. They get distracted. So it's also onus on the faculty to try to concentrate when the seminar is going. If something important, definitely you go ahead and check it. But otherwise, try to refrain from fiddling the mobile. You know, that is something which we'll have to check actually. You know.
yeah. Good. So I think we will end with this. If anyone else has any point to say, we will end with this. Okay. Thank you very much. Bye.
Thank you, sir.